Hi, I'm Rob Lapporte, and I'm with Physician 360. We are bringing medical diagnostics into the home. So we've all been there, right? You or your proverbial friend may have had a little indiscretion over the weekend, and you're concerned about a possible pregnancy. So what do? You obviously grab some urine, you bring it to your doctor, right? The doctor takes some of the urine, injects it into a rabbit, waits 3 or 4 days, kills the rabbit, then they inspect the ovaries and tell you whether you're pregnant or not, right? No, because it's 2016 now, right? It's not 1927. So what do? You run down to the pharmacy, you grab a pregnancy test, and within minutes you've got your answer. Wouldn't it be great if we could do the same thing with simple tests like strep and flu? So one of the core principles of Stanford MedX's Everyone Included trademark is the notion that people have personal ownership over their health. And we at Physician 360, we couldn't agree more. We believe it's time to empower patients and to trust that the prudent layperson can very well perform simple tasks like strep and flu out of the privacy of their own home. So it's estimated that about 46 million people each year seek medical attention for a sore throat. And of those, about 11 million people are diagnosed with strep. Pretty staggering numbers. So we at Physician 360 have developed the first one-step, self-contained Strep Tester. This is provided for home use, and we have taken current technologies and enhanced the sensitivity by about 30% while having no negative impact on specificity. We'll have 2 versions available. One version is going to be the aforementioned home version. This one will involve a physician interaction, albeit without ever having to leave your own home. And the second version is going to be for medical personnel. Future versions are going to be testing for influenza, STDs, pink eye, or otherwise known as conjunctivitis. So who is our market? Retail, CVS, Walgreens, etc. Telemedicine companies, insurance companies, emergency rooms, at medical facilities, urgent care centers, primary care physicians, and school nurses. How great would it be if you didn't have to get called out of work when little Johnny has a sore throat because they want to make sure that he doesn't have strep? If the school nurse can rule it out at school, then maybe he can stay in class and you don't have to get called out of work. So my child has a sore throat. What are my options? This picture is actually my daughter, Sophia. I was trying to get a picture of her frowning to look upset, like she had a sore throat. She couldn't quite grasp the frown. She kept smirking while her mouth was straight, so she kind of cheated a little bit. So one of the options would be to quarantine her, right? Build a big wall, a huge wall, a wall so high it's going to make your head spin. Of course, while this may help diminish the transmission of the disease, it's really not going to do anything for your poor kid. So what other options do we have? You can email your doctor, right? Well, just be careful, though. With emails and HIPAA violations, you might end up having to scrub your hard drive. All right, kidding aside, you can go to an emergency room, right? Well, I've worked in an emergency room for about 18 years, and I've seen many ERs that look like this inside. You could wait 3, 4, 5 hours to be seen for a 5-minute test because, of course, they prioritize the life-threatening illnesses first, the chest pains and head injuries and things like that. So the other thing to consider is that while you're in that waiting room and the guy next to you is coughing up a lung, you might end up contracting a problem much larger than you came in with. So next option might be an urgent care center, right? Well, they have limited hours and they're not always the most convenient thing either. You can call your primary care physician and make an appointment, and you might get seen tomorrow or the next day or a week from next Thursday. Should know, though, if you wait too long with strep and you're not treated, you can come down with serious problems like rheumatic fever. So it seems like telemedicine would be the ideal place to go, right? It's convenient, it's inexpensive, you never have to leave home. One caveat, though, one problem, is that they're about 70 to 75% accurate in diagnosing a sore throat, whether it's strep or viral. Strep, as you probably know, is bacterial and does require antibiotics. Viral does not. So that being said, about 45% of patients who do go to a telemedicine company and have viral pharyngitis end up with a script for antibiotics anyway. It's completely unnecessary and it adds to the resistance problem that we're having. So who will benefit from our product? Patients, as I mentioned, society as a whole with healthcare costs. There's about $87 per patient diagnosed with strep that will end up being spent for things that are non-medical, such as time missed off of work, childcare, etc. Insurance companies, imagine the insurance companies will save so much money by patients not having to go to ERs for simple little things like this. Telemedicine companies, they will increase their utilization because people will trust their diagnoses. And medical professionals can increase efficiency of their workflow with a one-step test. So where are we in the evolution of our company? We've filed for our patent application. We are currently in the process of getting FDA approval. We're working on strategic partnerships with retail companies, with insurance companies, and with telemedicine companies. Next will be manufacturing, distribution, and marketing. I wish I had time to give a nice introduction to my partners, but they are unable to be here over this week, and I hope to be able to introduce them to you personally next week. They're incredibly qualified individuals. So I hope next time you or a loved one is feeling under the weather, you can kick back, put your feet up, get treated at home accurately with our help. Thank you very much.